Knock, knock, knock.
Come in.
Hi, Mr. Pissarro. My name is Jenna, and I'm going to be your student nurse today. I'm going to be here to do a physical assessment. Do you need anything before we get started?
No, thank you.
Do you have to use the restroom?
No.
Okay, I'm going to pull the curtain for some privacy, and I'm going to go ahead and wash my hands before I get started. Okay, I washed my hands for 20 seconds, and patient's room is safe. Now I'm going to go ahead and ask him some questions. What's your name?
Richard Pissarro,
Okay, and what's your date of birth?
July 2nd, 1949,
Okay, and why are you here today?
for physical assessment.
And do you know where you are?
Yeah, I'm in the hospital.
Okay, and what year is it?
2021.
Okay, perfect. Patient is alert, awake, oriented to person, place, and time. Can I touch your head?
Sure.
Okay, we're going to do a physical assessment. Is that okay?
Yeah, it's good.
Okay. We have no lesions, no alopecia, no lumps, no lice. Taking off my gloves. And now I'm going to go ahead and check your nose. Can you lean back?
Sure.
Good. And I need you to smell this. Can you cover one nostril and smell?
Lavender.
Good. Now cover the other nostril. And I need you to do this one. Tell me what you smell.
Peppermint.
Okay, perfect. Cranial nerve 1, olfactory, intact. No drainage, no deviated septum, no lesions. Everything looks symmetrical. Can you read my badge?
Sure. Jenna Pissarro.
Okay, and what's that sign over there say?
Exit.
Okay. And can you just follow my pen?
Sure.
Okay. And I need you to look into the light. Look away and look back. Look away and look back. Okay. Now I need you to follow my pen light again. Okay. Conjunctiva is clear. The scleras are white. Everything looks symmetrical. Our optic nerve number 2 is intact. Vision acuity is good. Then we have our cranial nerve 3, which is oculomotor, intact. Cranial nerve 4, trochlear, intact. And cranial nerve 6, abducens, intact. Eyes are pleura, which our pupils are equal, round, reactive to light, and accommodation. And now I need you to go ahead and actually tell me if you feel any pain.
No. No. Nope.
Okay, and chew. Okay, does that hurt?
No.
Okay, and now push against my side. Okay, other side. Push against. Okay, close your eyes. Tell me if you feel that.
Yes.
What side?
Left.
What side?
Right side.
Okay. So cranial nerve 5, trigeminal, everything is intact. TMJ is centrally and bilaterally good, and no pain when mastication. So now we're going to go ahead and go to your face. Can you go ahead and smile for me? Raise your eyebrows. Okay, and puff out your cheeks. Okay, perfect. Everything is bilateral, everything is symmetrical. Cranial nerve 7 is intact. I'm going to check your ears. Okay, no drainage, no edema, no swelling, everything looks good. Now I'm going to check behind your ears. Do you have any pain there?
No.
Any pain?
No.
Okay, good. Okay, I'm going to whisper behind your ear. Cover this ear. Tell me what you hear.
Blackberry.
Okay, now do the other side. Tell me what you hear.
22.
Okay, perfect. So, cranial nerve 8, um, acoustic and tact. Okay, we're gonna examine your mouth. Can you go ahead and open up? Say ah.
Ah.
Okay. Mouth is pink and moist with no lesions or bleeding, and teeth are of good dentition. Now can you go ahead and swallow? Do you have any pain when swallowing?
No.
Okay. No trouble speaking, no pain when swallowing. And can you go ahead and take out your tongue and go from side to side and touch the roof of your mouth? Okay. So cranial nerve 9, which is glossopharyngeal, cranial nerve 10, which is vagus, and cranial nerve 12, which is hypoglossal, are all intact. I need you to go ahead and push up. Okay, move your head from side to side, and then up and down. Do you have any pain or tenderness when moving?
No.
Everything feels good?
Good.
Okay, so cranial nerve 11, which is spinal accessory, intact. Everything is bilateral and symmetrical, and everything feels and looks smooth. Okay, now I'm going to check your neck. Do you have any tenderness right here?
No.
Here? When you
No.
swallow, everything feels good?
Yep.
Okay. Now I'm going to go ahead and listen to your carotid artery. Hold your breath. Breathe out. Okay, hold your breath. Breathe out. Okay. No, Brui, he has his trachea is midline when he swallows. He has no lumps or lesions. Okay. Skin tuger. Looks good. You're hydrated. Now I need you to lean back. Okay, and now lean forward. Okay, no JVD. Okay, I'm gonna go ahead and listen to your heart. Your aortic. Your pulmonic. Your Erb's point. Your tricuspid. And your mitral for 1 minute. S1 and S2 is normal, no abnormal sounds. Okay, I'm gonna go ahead and examine your lungs now. Can you face this way for me? Okay, I need you to breathe in through your nose and out through your mouth. Breathe in. Out. Okay, lungs are clear with no adventitious sounds. Now I need you to face towards me. Arms up. Lungs and chest are bilateral, and AP diameter is less than half of the transverse. Okay, so our patient is in the supine position, and now we're going to go ahead and do the abdomen. And I'm going to ask you, when was your last bowel movement?
20 minutes ago.
Okay, and are you having any pain in your stomach?
No.
Okay, and is there anything that I need to know about? Any lumps?
No, I'm good.
Okay, so I'm going to touch your stomach. Palpate. I'm going to palpate your abdomen. Does this anything hurt?
No, not.
Okay. And now I'm going to listen to the bowel movements. I'm going to start in the bottom, the right lower quadrant. And I'm going to listen for 5 seconds. Well, I'm going to listen until I hear something. Okay, all sounds within normal range. And now I'm going to go ahead and listen to your aorta. I'm going to listen for 1 full minute. Okay, no bruit. Everything is within normal range and no abnormal sounds. Okay, now we're going to check your upper extremities. I'm going to palpate your arms. Just make sure that the temperature is equal. Okay, and now I'm going to listen to or feel for your palpate your brachial artery. Okay, your other side. Okay, now your radial. Okay, now let me see your hands. Wiggle them for me. Okay, capillary refill is good. CMS intact. Now I need you to go ahead and bring your arms out. Then bring them in. Now flex. Push it out. Okay, now go like this and go like that. And then I need you to push up against my hands. Okay, good. And then squeeze my hand for me. Okay, good. So temperature in the upper extremities is normal, bilateral, everything is symmetrical, range of motion is good. His brachial and his radial are +2. And CMS is good. Now we're going to check your lower extremities and make sure everything is good.
Okay.
Your posterior tibialis. Put your feet down. And then your dorsal pedis. Now I'm checking just for DVT. Okay, and then I need you to flex your feet down, push your feet up, push against my hands. Okay, wiggle your toes. Okay, push your feet, your legs out, in. Okay, range of motion, good. And then now I'm going to just make sure, wiggle your toes. Okay, good. So everything is symmetrical. The temperature in the legs are bilateral, no DVT. The pulse is +2. When we do our genital urinary assessment, we're going to ask questions like, when was the last menstrual period? Do they have any pain when using the restroom? Do they do regular testicular examinations? How often? Is there any abnormal discharge, any lesions, any hair loss? And if not, you report those findings, whether they have them or not, and you do hand hygiene and take off your gloves.